between policy, science, and communities. And third objective that we would like to achieve today is that we would like to identify a few pathways for scalable and equitable cooling futures. So these are three objectives that we would like to achieve in today's roundtable meeting. And to achieve that, we will explore how Maharashtra is transitioning or transforming from heat wave response to long-term cooling infrastructure. We'll try to highlight successful local and district level initiatives integrating cooling into health sector, housing sector, labor, and urban systems. And last but not the least, we'll also try to identify policy, technology, and partnership opportunities to scale inclusive solutions for everyone. And this will be discussed by an exceptionally experienced and talented panel of speakers. And each of them are contributing to a unique lens to the heat cooling challenges, not only in Maharashtra and India. But before we begin listening to them, we would like to announce that this roundtable also marks a launch of a special issue of our South Asia Disasters.net, which is titled as From Heat Waves to Cooling Futures, Maharashtra's Leadership in Climate Action in India. And I would like to request my colleague Manish Bhai to kindly release it online and also share a downloadable link or actual publication in the chat box so that everybody could access it. And just to highlight what this publication is all about, this publication brings together breakthrough research, policy innovations, and community voices to help reimagine cooling as a critical public goods, not only in Maharashtra, but also in India. Now, so, Manish Bhai, is it done? Have you launched the publication? Okay, it is done. Thank you, Manish Bhai. And now let us begin on our discussions. And our first speaker for today is Ms. Sujata Saunik, former Chief Secretary of the Maharashtra Disaster Management Authority and Harvard TechMe Fellow. She has been a national leader in governance reform, heat resilience, and climate smart public health systems. And she will open our roundtable with welcome remarks and agenda setting. Over to you, Sujata ji. Thank you.
Thank you so much, Mehul Bhai. Are you all able to see my screen now? Yes or no? Yes? Okay, great. So that's wonderful. So thank you for your kind words, and I'm very happy to be a part of this very august gathering. And I thank AIDMI for organizing this roundtable on a topic which is very close to my heart. Last decade of mine while in the service was dedicated to this issue in a broader context, with along with disaster management, climate change, and also looking at public health, the impact of climate on public health. So I'm very happy to be here today. I thank the organizers for giving me this opportunity. In the next about 8-9 minutes, I will take you through what are we trying to do here in the state of Maharashtra. I may begin by saying that Maharashtra has always been in the forefront of this issue as well as many others. So many innovations have come out of Maharashtra, one of which I can name that Government of Maharashtra also set up the first AI and ML own startup company under the government 2 years back. And now it is the AI tools are being used by almost all departments. So we have always been at the forefront. So going forward, why is Maharashtra leading or trying to lead, I should say? The reason is this state, as you can see on the map in front of you, has been, a state which suffers from a lot of natural disasters. It has been a part of our past and very much a part of our present. So many districts suffer from different types of disasters. Heat has now become a very big issue It used to be earlier in the eastern part, or what is called the central part of India, the Vidarbha, as you know, Marathwada and then Vidarbha. These areas were always traditionally more affected by heat, but now you see that even the coastal areas, that is right from Palghar down to Sindhudurg on the western coast, also suffer from high heat. And this has led to a spike in the kind of disease burden that the state is dealing with. So it is impacting not only public health, but also impacting the livelihoods of people. So increasingly, our infrastructure, our health systems, and the groups who are vulnerable, the ones who are migratory or who are more exposed to the elements, are suffering. They are at greater risk. And there is definitely a need for more predictive and preparedness focused action in the state. And this is what propels Maharashtra's policy on this topic. So what have we tried to do within the government? I'm no longer a part of government. I can speak freely. However, I can definitely explain what the government has been trying to do. So there has always been a more integrated approach across sectors. We try to break down the silos. What helps is that the highest authority of the state, the chief minister, himself runs something called a war room. I think that's become quite a pattern in other states as well. And in this war room, he looks at, things from a sort of integrated lens rather than each department trying to do what they should be doing as per their mandate. Now, why is it that government is always, talked about as working in silos? The reason is we work as per a rules of business, and the rules of business mandate what your portfolio is. So typically, a government department cannot go outside of those rules unless and until the leadership in the state asks them to do so. In our state, the leadership is very cognizant of the fact that these are issues that impact people, and therefore we have a much more integrated way of dealing with this. So we have already a statewide heat and disaster preparedness framework, as Mehulji already alluded to. We have a very strong institutional setup. The SDMA is chaired by the chief minister and both the deputy chief ministers. The meetings are held regularly and issues of concern are always flagged in this. And the most important thing, if I could highlight, is that we go for more evidence-based, technology-driven initiatives. And that is why I mentioned right at the outset that we have an AI ML startup company under the government, which is able to procure these tools. Of course, it comes at a cost. Nothing is free, but we get the best tools to help us to decipher our data. So what is it that we have done so far? Heat action plans, I don't even talk about them anymore. They have been around us, they are there. A lot of hard work has gone into them. Now we are looking at more granular data at the local level because it's a huge state. Nasik, which is one of the districts of Maharashtra, is more than 30,000 square kilometers. Ahmednagar, which is the biggest district in the state, also has several tehsils. So you can't have one plan for one area. It has to be very granular. So that's what we are trying to do. And there is, of course, interdepartmental heat guidelines for our workers. So internally also we have guidelines for all our workers, for students, for our hospitals, for all our public buildings. And then, of course, we have already executed what we call the urban cooling measures, which everybody knows about. But what is different here is that, as I mentioned in my last slide, it is more evidence-based. So it is not about, you do a little bit here and a little bit there and you hope that everything is working. No, it's not like that. We look at what is the requirement at a particular place and try to put that intervention for action in that area. So it's not like, generally like how you do fogging during the monsoon season, you fog all the areas, irrespective of whether the larvae are actually growing there or not. No, it's not like that. It's much more evidence-based, very, very precision kind of interventions we do. And then, of course, we have this integration of health, labor, urban planning, disaster management. So our disaster management department doesn't work in silos. It is very much connected to all the major departments and works together. And we have a very robust data flow and data management in the state. So what are some of the strategic investments in climate interventions or, in basically in trying to deal with the impact of climate that the SDMA has done? I'm talking about the State Disaster Management Authority here. So we focus on predictive technology enabled resilience. Now the word resilience is also something that the state has started to use from a few, I think, years ago. we are no longer talking only about adaptation or mitigation measures. We are talking about building resilience. Why? Because these things are not going to go away. Much as you and I would like to wish, that's not going to happen. It's only going to get worse. I always give this example. Gold prices have gone skyrocketed over the years. No matter how you wish that they would come down, they don't. They are actually going up. Similarly, in disaster, what you notice is that the impact and the frequency of these climate events is increasing, and therefore you need to build your own resilience, the people's resilience, the system's resilience, to be able to deal with it. And strengthening of health systems and disaster preparedness at local level is very much a part of it. So I'll talk about two projects that have been recently rolled out to exactly achieve those results. And of course, I mentioned AI and the use of data analytics in our policy setting. So, what are these two projects? What are these all about? So, the first one is an AI based disease prediction e tool. Now, this is something I had worked in 2015 and 16 with the help of UNICEF. Anand here, my dear colleague, is from UNICEF and he knows about it. We have now tried to roll it up to a state level action plan. So initially we did only two districts, Pune and Nagpur. We looked at the link between disease outbreak and a particular phenomena of the climate, like for example, heavy precipitation, or we looked at outbreak of, we looked at outbreak of diarrheal disease linked to temperature. So this was done along with the National Institute of Virology. So one of the things that the state does is work with technical institutions who have the expertise and the people, the faculty available to help government departments understand what's going on. So that's a very, very good thing about Maharashtra. So we try to integrate weather, environmental and health surveillance data. All this data is already available. We had never layered it before. So this was a layering done for the very first time. And that helped us to get insights into which particular blocks and villages and wards in these two districts. We did that as two districts, Nagpur and Pune, not just the city. Which are those areas and which are those months and weeks when the spikes are coming, and what is the temperature and precipitation level at that time. And that gave us wonderful results, which could help enable early warning systems and the managers at the local level, that includes the revenue and disaster managers, to be prepared for what's going to come. And we didn't look at last 10 years data, we just did 2 years, and that was enough to see the results. And this definitely helped the health department to deal with the outcome which they knew is going to come, in which areas it's going to come. Now this, as I mentioned earlier, has been scaled up into a state level action plan. So this is being done with the Indian Institute of Technology in Mumbai. By the way, the Indian Institute of Technology in Mumbai has more than 35 schools that work with different issues connected with disaster management and public health. So really we have a very robust faculty and experts available very close to where we work and with whom we engage for the benefit of our state. So the second project is Heatwaves. That's the name of the project, and it is basically Maharashtra's heat research and analytic initiative. So this again is something that we have done in partnership with technical bodies who can support us. And we have looked at comprehensive research on heat impacts across regions. So we picked up 3 regions now. So one, of course, is the Nagpur area. Why? Because Nagpur is the center of India. Also, it has very high temperatures and a very early summer. It starts even as early as beginning of February, and it lasts for 4 months. So it's a long period of heat. And that's another thing that I always tell, the gathering wherever I speak, that in India, monsoons dominate the discussion around climate. We are so consumed by what happens during a monsoon that the summer, which is short but it's very intense, sometimes gets sort of pushed back in terms of its impact and really its impact now on the economy as well. So we have looked at satellite data, local measurements, and socioeconomic data is a layer. As I mentioned, this we learned about 8 years ago when we did the first project, which has now been scaled up. Government of Maharashtra has given financial outlay for that. So now we are looking at district, taluk, ward level heat spots, And this is supported also by very targeted cooling investments and policy reforms. That includes things like, do we need to change the kind of uniform the state's bus service and also the city bus service personnel are wearing? What should be the kind of uniform code for people who are coming to work in a public building? Do we really need to insist that they wear XYZ, or can we move towards more healthy, breathable fabric that allows you to walk and work effectively? And then giving breaks in the afternoon heat and allowing them to go to a room which is cool and quiet, and they can take a break. And also it talks about the kind of nutrition and diet that they need to follow. So even within our buildings, what kind of food is being served, and whether we have enough water stations. And this doesn't just work for the people within the government, but then outside the government, how do you make sure that people at large who are moving and commuting and who are going out for daily wages are also getting the same support from their employers, is something that the policy is taking care of. So more support for targeted cooling investments. And there is, you must have heard about Mitra. It's a planning body at the local state level. They're also now looking at providing loss of wages compensation to people who lose wages because of their condition during a very high heat kind of period. And then of course we are looking how to build a long-term heat risk evidence base for the state. How do you learn from each year and sort of go forward a little bit more resilient than the last year? So this heat illness is rising, and the deaths that are also there linked to heat but never actually listed as deaths is because usually get noted down as the comorbidity issue. So how do you record properly, and how do you make sure that, as I mentioned, these two hotspots in the beginning, the Vidarbha area and the Konkan area, how do you make sure they are able to cope with what is happening in those areas, and you provide material to the local teams to do it in a better way? And how do you also deal with the high humidity? So far we were only talking about heat. Nobody was talking about the wet bulb temperature and what impact it has on people's health. So now looking at that, and so we will now be working on a micro level, very settlement specific evidence across urban, rural, coastal, inland, hilly, plain, all areas. But the plans will be different from these areas, is what we imagine. It's not going to be one thing that is for all of them. So the outcomes here will be microclimatic plans, a digital twin simulation for scenario modeling, more of analytical reports, capacity building tools, and a white paper for policy action. So we are not outsourcing this to some consulting firm. They'll write a nice report and bring it to us. We are very much going to be involved in that. So the DDMAs, the disaster management authorities, and the their staff, both within public health and on the revenue side, will be involved in doing these studies along with the technical partners, which is again this has been given to IIT Mumbai. So how are these projects strengthening Maharashtra's climate governance? You can see it right there. I don't need to say it aloud again. The efforts is very much to ensure that we have better predictive models across districts, particularly the ones that suffer the most. We embed cooling in urban planning and health policy. So ultimately, we will have to go more towards the kind of infra we are building. Has to be more attuned to the climate of that area. Investing in community-based early warning systems. Obviously, when you know it's going to happen and the period when it's going to happen, you can prepare better for that particular event. And then building partnerships with research institutions. This is what makes me happiest, because you cannot do it alone. We need to integrate anybody or any institution which has knowledge and has the resources. If we can work along with them, I think then that's really the best way forward. And the idea is to create a more resilient, safe, and climate ready Maharashtra. So I stop here. I am sure that others in this conversation today will be adding to this discussion, and I will conclude my talk here and hand over back to Mehulji. Thank you, Mehulji, and I'm stopping my share.
Thank you so much, Sudhata ji, for highlighting Maharashtra's strong climate governance and institutional leadership. It was also very useful and informative for all of us to learn about the AI-linked disease prediction model that you shared with us today and how such models could be used for decision making. Also, the second project, Heatwaves Analytics, again was very useful for us, especially for those who are gathering evidence to influence policymakers. So thank you so much for sharing this valuable information with us. And in the end, you also shared very clear roadmap for targeted cooling in Maharashtra at micro level uh, and also at the community resilience pathways that you have shared with us is very useful to all of us. Thank you so much. Now I would like to invite Mr. Anand Godke, was CCES officer at UNICEF India. He brings over 26 years of experience across NGOs, CSRs, multinationals, and the government. And his work integrates WASH with nutrition, health, education, social policy, and child protection. He will speak on the Green Project mitigating the climate risk impacts in Maharashtra. Over to you, Anandji. Thank you.
Thank you, Mel. Why? Please confirm if I'm audible.
Yes, you are audible.
Yes, thank you very much. And it's always a pleasure to listen, Sujata ma'am, with such a kind of diverse knowledge, of course, with the kind of experience he comes with. And you have seen the kind of initiatives, the governance initiative that government of Maharashtra has taken to adopt to the, climate change impact. So I'm just trying to kind of look at one of such initiative which was undertaken by the Jilla Parishad of Nagpur. When it comes to UNICEF, we always work initially with the government systems, and this is an initiative that was taken up by Jilla Parishad Nagpur. And then we join hands with Nagpur Jilla Parishad to kind of, look at what are the good opportunities in that. In the meantime, I'm very happy to also share that as far as the NDCs are concerned for the country, Maharashtra states do have now the second version of the SAPCC, that is the State Action Plan on Climate Change. So this basically, is a kind of demonstration, I would say, that looked at how do we kind of move from land to lab instead of moving from lab to land, because when we have, leadership that actually promotes these kind of initiatives that helps to kind of get us good solutions. And we named this project as a green project because it talks about 2 to 3 things in not in isolation, but the collective power of some of the known and implementable technologies that have been in discussion for now decades together. So we called it as a cyclic approach for green loop, and the idea was to propagate the climate smart institution when it comes to the remote areas or even the peri-urban or semi-urban areas. And ma'am talked about Nagpur. All of us know the orange city, but it's also the hot city as far as the climate is concerned, and particularly the lean period. I mean, that has now been increased from our assumption of 60 days to close to 150 days, and that's what we are experiencing in the state. And the other idea was to look at how the healthcare systems could be the infrastructure could become more resilient along with the communities as well. And what it involves is little bit of structural upgradation that leads to two problems, I would say. It offers an opportunity to demonstrate our interventions, and second is that existing it's a solution to address the existing problems. Like there is a leakage during monsoon, but if we can go for that kind of structural upgradation, it also helps to kind of increase the life as well as the resilience of the infrastructure. And of course, I need not to mention that it does aligns with the sustainable development goals. And all of us are aware about the extreme situation that the projected population of more than 2 billion children is expected to, in either case, whether we take actions, whether we don't take actions. the temperature increase is going to be there by minimum 1.7 degrees and to the maximum or a threshold of 2.4 degrees centigrade. So about the green project, this, as I mentioned, that it was taken up in some 7 facilities in Nagpur district, in various blocks and in various remote locations, which included the institutions such as schools and the healthcare facilities. With an average annual rainfall of about 1,000 millimeter, though that kind of climatic or weather conditions Nagpur has got, but at the same time heat is also a problem. And we all are aware about the other issues, the supply versus demand side management, as well as how do we look at the intensive agriculture and the urbanization in itself. This program also tried to kind of look at the national program on climate change and human health, which was launched by the government of India in the year 2023. And this also kind of it's a very kind of simple collection of technologies together. And if I have to put it pictorially, it's a very simple thing. It talks about water harvesting, it talks about water recharge for groundwater recharge, and then it talks about how do we convert the existing roofs with some kind of structural upgradation, and how do we kind of use the solar energy to use as a cycle in itself. So how do we use the rainwater harvesting to recharge the groundwater, use the roof to cool the inside of the facilities, and use the groundwater to kind of use the solar energy rather to pump the groundwater, or use the stored water to pump and use it within the facility. And then this, I being a little selfish here, is also talks about managing the water sanitation and hygiene, particularly in schools and the health facilities where we have the vulnerable population, like the patients or the school students. I talked about these retrofitting features. It definitely takes into consideration the existing roof, the food grade quality white paint. Nowadays we have been seeing this in many places. How do we kind of tackle or keep our surfaces cool using that kind of paint? Then there is a self cleaning filter, a storage tank, and then interestingly, the government of Maharashtra's water supply sanitation departments, one of the technical wing, the groundwater surveys and development commissionerate, that has actually come up with this recharge shaft technology. And of course, another innovation was the dual pump by the same agency with the hybrid solar pump. This I'm going to skip. This is just a kind of animation. It will take about 1.5 minutes, but I'm going to skip this. This presentation can be available. Uh, uh, we will go to the practice. We'll go to the some of the examples where this project was implemented, I would say, initially. And you can see the online filter, which has a self cleaning characteristics based on the centrifugal force. I mean, simple technologies with simple science that has been used. And then you see the rooftop rainwater harvesting. How do we kind of use the slope and use the white paints, and we have the solar panels and the recharge shaft. If you can see that also is actually used to use the rainwater, harvested rainwater, to recharge or to store as per the requirements. Some of the kind of examples of calculation, I would say, in one of the PSCs. This is in Ramtek block of Nagpur district, Nagardan PSC. If you look at the calculations with all considerations, the annual rainfall, the roof area, the coefficient of friction, and how much amount of quantity that can be harvested, and what amount of quantity that is required required by that facility. So it exactly comes to the similar. So if we harvest the rainwater within that roof, we will be able to manage that, and then there won't be additional burden on the other sources that are existing. And the surplus water definitely can be used to recharge the groundwater. Some more calculations in terms of use of solar pumps, and a lot of the emissions can be stopped, the carbon dioxide. And if we have to look at the solar net metering, I think that is one of the beautiful thing that we could capture in this, that the consumption goes down by close to 60%. There could be a little bit of variation depending on the season, but yes, there is a kind of good result that is showing flowing, the consumption reduces by 60 to 70%, which means in other way around, it is actually reducing the cost. It is actually reducing the dependency on the regular electricity supply, particularly in the rural areas. And the instruments and facilities within the in the facilities can be kept operational and functional. Another good observation that came, and we monitored it for about 12 to 15 months. And this temperature data we collected in 5 locations. And if you could see the green bar, that shows that that is the kind of temperature difference on an average. Of course, this does not claim that only the roof which is painted with white paint only is responsible for that. There could be other factors, external factors that could be influencing that. But we can definitely say that with this kind of intervention, we should be able to lower the inside temperature of any facility by minimum 2 degrees centigrade. Although the average says about 3.43, and this is done very kind of layman's approach. We had this. Thermometers fixed at various locations, trying to kind of have a demo plot as well as a control plot, and this is something which is very encouraging. I talked about the reduction in consumption of the electricity, and we see that it is like close to 60% of reduction in electricity. And this we monitored from August 23 till November 24. I think we went up to February 25. This is the kind of investment that UNICEF made here. For 7 facilities, we spent about 16 lakh rupees. And these calculations gives us how much we tried to kind of see what could be the cost per meter cube of water that could be harvested. We tried to understand what could be the cost per treatment for the roof area. This I think is one of the very simplest calculations, and that gives us a confidence that yes, this can be adopted, this can be done. And in the end, I think when I would rather say that some of the critical points that which Madam also talked about as a policy, or as a kind of I mean, it should not be only a policy that government should kind of enforce on people, but the community engagement is also key to that. I mean, easily people can afford an investment of 3 to 4 lakh, and the buyback for by the return on this investment is about 3 to 4 years, if we consider the reduction in the electricity bill and the other benefits out of that. So in a nutshell, if I have to say so, this is something which has a huge potential to adopt at the household level, not only in the institutions but everywhere this can be adopted for the mitigation and adaptation purposes. There is no or less operation and maintenance concerns as far as this approach is concerned. The household or the institution team can definitely look at, and we did a kind of check, a check on what is the status of the investment and the infrastructure that was created. We could find that 70 to 80% of infrastructure was in place. But when it comes to institutions, I think always we see that O&M is a concern. But if at the household level we look at this, I think this is going to be very encouraging, that there would be low O&M concern for this. And I think more and more demonstrations and deliberations, addition of new technologies, addition of new kind of interventions would bring the cost effectivity for that. As I said, that not only government regulations, but the incentivization, as ma'am also talked about the initiatives by the government, and we do have some of the initiatives launched by the Prime Minister, like the Suryagar Yojana and other solar incentives, and there are definitely some other schemes which are useful. But this needs to be kind of looked as community as a whole. Maybe this could be tried out in 10, 15, 20 villages across these hotspot areas where heat waves is a concern, and then definitely I think we will be able to get more solid results. And the community support, of course, as I said, it's a key. I would say that the climate change, these impacts and all those climate-induced impacts should be, although it looks like an alarm, or it is an alarm nowadays, but I would say that it is an opportunity. Like we always say that pandemic was an opportunity to keep ourselves prepared and geared up for the these things. Managing the impacts. We have not gone into the relation between the health or disease outbreaks and all those things, but I'm sure this definitely is a very good kind of solution at the facility level for the patients and for the students in the schools and the institutions. And we are now exploring the opportunities to try this out at the household level, so that we get more encouraging results. Mehul bhai, I have a colleague from Nagpur Jilla Parishad, Mr. Mankar, who is a deputy engineer mechanical, and one of our retired colleague from government, Mr. Anil Trivedi, who has joined this workshop, this webinar. So I will just request for a minute or two for Mr. Mankar to just speak in, because he is one of the key person who has actually taken this forward. I must also acknowledge the support that was provided by Mr. Kumbhekar. He is now collector, I think, Bhandara. He also took that, and actually encouraged us to take this forward. So, Mankar Saab, if you're there, please come in for 2 minutes. Yeah, thank you.
मानकर साहब, आर यू है? आप है?
हाँ, यस यस सर सर।
आप बोलिए।
अभी सर गोडके सर ने जो बताया वो बात सही है, क्योंकि हमने जब प्रोजेक्ट स्टार्ट किया था तो सबसे बड़ा चैलेंज यहाँ पे ये है सर कि जो गवर्नमेंट बिल्डिंग्स होती है वो प्रॉपरली रेन वाटर हार्वेस्टिंग के हिसाब से नहीं होती। उसमें क्या होता है कि जो बिल्डिंग होती है उसमें ना प्रॉपर पैराफिट वॉल होती है, ना स्लोप होती है, और सब चीजें होती है। तो ये हम जहाँ मैं नागपुर में काम करता था वहाँ पे सब रिमोट एरियाज था, जैसे रामटेक ये रिमोट एरिया में आता है, और वो काटोल और नरखेड़ी ये जो ड्रॉट एरिया में आते हैं, यहाँ की वाटर लेवल बहुत ही डीप रहती है। तो इसके लिए हमने सबसे पहले स्टार्ट किया था कि जो एग्जिस्टिंग बोरवेल है उसका यूज करना है हमें, ना कि नया कुछ रिचार्ज शाफ्ट खोदना है या नया बोरवेल लेना है। तो हमने सबसे पहले बोरवेल फ्लशिंग का प्रोग्राम चालू किया था डिस्ट्रिक्ट में। उसमें से करीबन 2-2.5 हजार के आसपास करीबन हमने बोरवेल फ्लश किए थे। उसमें से जो बोरवेल हमको पता चले कि यहाँ पे वाटर लेवल पहले थी और अभी डीप हो गई है, तो सबसे पहले प्रोग्राम चालू किया कि उसको पहले हार्वेस्टिंग करो। तो फर्स्टली हमने क्या किया कि जो प्राइवेट जो घर थे लोगों के, उनके घर का पानी सबसे पहले उसमें रेन वाटर हार्वेस्ट किया। जहाँ नरखेड़ तालुका की बात है तो सावर गांव एंड अदर गांव जो है वहाँ पे हमने किया था। फिर उसके बाद हमने गवर्नमेंट इंस्टीट्यूट, स्कूल, आंगनवाड़ी एज वेल एज पीएससी प्राइमरी हेल्थ सेंटर में भी वही किया। फिर हमको पता चला कि ये प्रॉपर बिल्डिंग्स नहीं है, तो बिल्डिंग को प्रॉपर रूप देना, ट्रीटमेंट करना, उसके बाद उसको प्रॉपर स्लोप देना, और देन यू यूज हीट हीट पेंट जो व्हाइट पेंट होता है। तो पता चला कि हमको 4 या 5 डिग्री तक नीचे का टेम्परेचर भी रूम टेम्परेचर कंट्रोल होता है। और उसके बाद क्या था सर, वहाँ पे सोलर थे हमारे, 1 HP 2 HP के सोलर थे। तो अभी आज के जो नई टेक्नोलॉजी डुअल फेशियल रहता है सोलर का, तो उसमें से क्या होता है कि जो रेज बाहर निकलते हैं वो ऑटोमेटिकली चार्जिंग होना चालू हो जाता है जो सोलर प्लेट। तो उसमें से करीबन 20 to 30% तक सोलर इफिशियंसी भी बढ़ती है। तो वो भी एक हमने फिर डेमोन्स्ट्रेशन किए थे, तो वहाँ पे भी हमको थोड़ा अच्छा फायदा मिला कि करीबन 1 यूनिट तक ज्यादा जनरेशन होता है 1 HP 1 किलोवाट के अंदर। तो ये सब चीजें हमने की थी, और ये जहाँ पे जरूरत थी वहाँ पे मतलब वाटर लेवल डीप थी, तो वहाँ पे अभी जो चालू किया ये प्रोग्राम तब से अभी वाटर लेवल भी बढ़ गए। और सबसे बड़ी इम्पोर्टेंट बात है कि लास्ट 5 ईयर नागपुर जेडपी ने एक भी वाटर स्केर्सिटी के अंदर बोरवेल नहीं लिया। जो पुराने बोर थे उसका ही यूज किया, उसको ही रीजनरेट किया। उसके बाद बाकी नया कुछ नहीं, जो भी लिए होंगे जहाँ जरूरत है वहाँ खाली रिचार्ज शाफ्ट के पर्पजली एक आधी जगह लिया है। बाकी देन वी यूज ओनली एग्जिस्टिंग बोरवेल्स। थैंक यू।
Thank you, Neeraj ji. Over to you, Mehul bhai. Thanks. I
थैंक
am
यू सो
aware
मच।
that there's a time issue. Yeah.
Thank you so much, Anand ji and Nilesh ji, for sharing the example of green project model. to make institutions climate smart and resilient. And I must say it's a scalable model, and it is something that we can all replicate in other parts of the country. And the most interesting part of your presentation was the practical application of solutions. I mean, the combination of solutions, cool roofs, rainwater harvesting structures, solar pumps that reduce heat stress, save resources, the energy, and also increase the water access. So that was all very useful to learn about. Thank you so much. And now we would like to invite our third speaker of the day, Dr. Milind Majumdar, retired senior climate scientist from IITM Pune and current chair of the Indian Meteorological Society Pune chapter. He is an expert in monsoon variability, soil hydrology, and climate modeling. He will guide us through smart cooling for hot summers, everyday climate smart living. Over to you, sir, Dr. Milind.
Thank you very much, sir. Namaskar ji. First of all, I am really thankful to organizer for giving me an opportunity, particularly Honorable Saunik Madam, making my job very easy and giving the confidence. Yes, I may be able to give some feedback here. And Godbole sir, Ghodke sir, uh, can you display my PPT or how to share this? My
Sure.
PPT?
Manish bhai, can we display? 1 मिनट में हो जाएगा. Please give us a moment.
Yes.
Is it
Yeah,
visible?
thank you. Thank you.
Okay, thank you.
So we'll go to next. I mean, of course, this background is already given, and we have been involved in this climate change, all assessment and modeling and forecasting. So this is what is the report. Just I want to flash here. This is available. This can be freely downloaded. I have given the website also, assessment of climate change over Indian region. So this is the first assessment carried out by Ministry of Earth Sciences, and it is available online. Next, sir. This is the little background. I just what is there inside the this assessment. So you can see that this our IITM has Earth system model. India's first Earth system model was really, I mean, had taken place, I mean, in shape in IITM, at IITM Center for Climate Change Research, and these are the assessment we have done. So left side, what you see is this. All these observations, what the trends are for temperature, precipitation, sea surface temperature, and then sea level, and then the Himalayan snow cover also. And the right side panel, you can see right side panel is the whole of future projections for next century, actually. So you see these things. This is the science, I mean, and this has been rigorously discussed. You can just go to next. Before going to next, you can just click it, and you will see that we had the India Meteorological Society. We had the international conference on this Intromet 2025 from 18 to 20 November recently, and lot of discussions took place on this. And importantly, just next you can go. So next slide, please. Yeah. So the importantly, the I mean, heat waves. What the major concern was, more than the heat waves, the heat stress, because of, as you know, the temperature rise. The whole, I mean, water holding capacity of the atmosphere, that is what is being major concern. And the nighttime temperature, actually, where is the even if you see the IPCC reports or this our assessment also, where is the confidence level? What we talk is, when we give the projection or what we tell about the climate change, now there are natural changes also, anthropogenic changes. I will not go more into details of the science, but importantly, the thing is this, the main thing is the nighttime temperature. The major concern is we have the confidence in raising question about the raising the concern about the nighttime temperature, rise in nighttime temperature, and the humidity as well as the atmospheric humidity. So you see that what it does is, actually, this is the urban heat. Like, I will just come to the main point, actually, urban heat island. This you can see the heating, the intensity, particularly the intensity. It is not the surface actually. What we call is the surface layer, a boundary layer, and the entire troposphere. How that influences the this temperature. Of course, the surface temperature, what is rises, various sources. I mean, I again need not, all the previous speakers, they have already discussed this. So surface temperature rise, that is one thing, that is one concern. But another thing is all the emissions and GHG emissions, and how we are this atmospheric composition is being affected. And that what it does is it traps the heat actually. And you can see that that is why the nighttime temperature, that is what the major concern of the rise in nighttime temperature, as well as the humidity also. I mean, of course, this again I will not go into the detail quantification. Urban areas, with how again the building type, and then the glass buildings and all this, there are various factors actually. But you can very clearly see that, I mean, if you see over the landscape, entire landscape, the temperature, I mean afternoon temperature 5 p.m. temperature, and the night time 5 a.m. temperature, you can see very clearly over the urban region. Main concern is over the urban region, how the diurnal variability, the range of diurnal variability is reducing. That is the main concern, and that traps the all gases. It doesn't allow the mixing, well mixing of the atmosphere. That is little science in this. So, and it traps all these things, and that is why the major concern over this Arabian, while you see over the as compared to the desert or other regions, if you see the agriculture field, the diurnal range is much more. So this is again landscape. I mean, landscape, how the you we are changing the land use, land cover changes also, how that is affecting. So main thing is this diurnal range. Again, I just want to emphasize is the decrease of the diurnal range, how it raises a great concern. Next, so next slide, please. So the thing is, of course, I mean, this has been already told, the what the buildings, what we can do. Main thing is, my main concern is this insulation of the building. Well, that is what, well, I mean, again, it has been told about Ghodke sir. So the and the whitening of the roof and other things that we have done at IITM. Many other things we have done, but particularly the building also, the glass building, that is what is creating the I mean, again, this how it is responsible for reducing the diurnal range of diurnal temperature. That is again a concern. Next, so I will come to this. One thing is, see the what we use to how we I mean we use the this refrigerator, this air conditioners, and what it does is actually, that is a very simple thing. It, to reduce the indoor temperature by 1 degree, it spoils the environment by 2 degree. So it raises the temperature of environment by 2 degree. That is really very, very unfortunate. And the thing is, another thing you see, that mainly what people use in at, if you see the micro level, what Honorable Sonic Madam had told about the micro level climate management or this thing, people use this ceiling fan. Again, it is the vertical circulation. You can see it is the turbulent flow it creates, and it doesn't allow the entrainment. So it doesn't allow you. There are very simple examples. I mean, when we go to school, colleges, of course, this is part of my hobby, and I have been doing it as an outreach. It's not my core region, but I've been doing this, and we put the smoke and things, and you see that how it gets trapped in the room. So the turbulent flow is not that I mean, user friendly, or say for human health, it is not good as compared to the, you will see that the laminar flow. So next slide. Yeah, so this is a very simple thing. I mean, it's, and it's, is it that I am first time showing? It's not that, people know that, but putting the cross ventilation. Now the thing is force cross ventilation. That is what is to be taken up in. I have been vouching for this in engineering colleges and HVAC. Instead of HVAC, we should have also, additionally we should have this force cross ventilation. How we can have, so this is the laminar flow. That is what is important. Technically we can discuss about this, and a lot of things can, and you see that, I mean, this lower power consumption, again you can quantify this. Normal backup we can work So these are the things, I mean, where to put the air inside, where to take it. There are many now these structures. There are earlier there used to be vents. Simple thing it is. There are no vents nowadays in all the, I mean, urban structure. You can see that. Next slide you can go. And this has been very well. See, I mean, we used to have interaction with German scientists and many, I mean, IITM, it is an international institute. Many people come. I used to vouch for this cross ventilation, and they have used it very systematically, very nice. They have, I mean, aesthetically and all interior, they have incorporated it. When we went to for a conference in Germany, so he took me to his home, Professor Ingo, and then he showed that how they have implemented it very nicely. The here the concept is, see, you can see this is the January time, and the outdoor temperature was -7 degree. It is other way, you see that. But the whole fresh air, what they used to do is this, they have put it, and it has a filter, it has a heater, and all 5 minutes it takes the air in, 5 minutes it takes the air out. So in the ducted, and one thing is very important, that we are living in the ducted environment once we put in the AC. And you can see this, all these extratropics or cold countries, they will have to have the ducted environment. But this house was very fresh air. I mean, morning if you have, I mean, cooked something bangan or this, till evening it keeps smelling. But in this home, it was fully, I mean, fresh air they were getting, and just using the simple funda of this force cross ventilation. Next slide, please. So this, what we used to do is, I mean, I used to make the poster. I have written several articles, paper, and this, of course, research paper writing is our main this thing. But this is you can see this, and meteorology, and I put this in meteorology in day-to-day life. I mean, we have to have the eco-friendly and energy efficient indoor cross ventilation. Yeah, that is what I call the force cross ventilation. You can see, if left side, if you see normal when the daytime, if you don't have the vent, again the same thing is, heat is trapped, there is no vent, there are no vents. And if you, even if the vents, simple vents, nowadays it will not work. You have to forcefully, you have to take the heat air out. And all this quantification, all the experiments I have done, you can see the quantification also. It makes, of course, I mean, it cannot be compared with the AC or other things, but evaporative cooling, you can use the evaporative cooling. Mist cooling, nowadays mist cooling is also there. So in again the water consumption, all those, if you see, you can optimize all those things, and then you can use this, and you can see the 3-4 degree temperature difference. If you use a simple thing, it's nothing great. Of course, you have to use this, I mean, depending on the outdoor temperature, or again I say, little meteorology. It's not like AC, you switch it on and you get the effect. It will take some time. I mean, again, the whole air to replace the volume of the that room and things, it takes time. But we have to have this, we have to have the climate adaptation also. So that is, I think, very important. Evening time, I mean, till evening, I mean, if you see, if you don't use this indoor cross ventilation, I mean, at the lower level you can take air in, and at the upper level you can blow the air out. It's not great thing, but I have been doing this, and I can tell you, with all these things, using all the sensors, timer and things, very simple. Of course, my background is not engineering. I am just this mathematics background. But the thing is, using this, I can just tell you, our monthly power consumption remains in 2 digit. So these are the things you can use. This, how this timer also you can use for I mean, coolers and things. And then how the water consumption, even the desert cooler, it produces this, it makes it super saturation. So how to use this, and this has been done, unfortunately, was Japan, China, all this they are doing. But these are all the small technologies, we can use it, we can modify that, and I think we can make it, I mean, human thermal comfort using all these resources. I think this is what I had to say. Thank you so much. Thank you.
Thank you so, thank you so much, Dr. Majumdar, for sharing the scientific evidence on climate change in India using projections on temperature, rainfall, sea level, and heat trends in Maharashtra and various parts of India. I think one of the key takeaways from your presentation for us is that, you highlighted that how simple low-cost cooling solutions like insulation, natural air circulation, and cross ventilation can work for everyone. And we really appreciate you showcasing a wide range of practical techniques that reduce indoor heat with minimal energy. So thank you for sharing your expertise and experiences.
Thank you.
Next, we have Dr. Shriti Arabati, Head Anubandha First Aid Academy, specializing in emergency response training and community capacity building. She will speak on first aid and frontline preparedness for heat emergencies. So, thank you so much, Dr. Shriti. Over to you.
Thank you so much for having me. Namaskar and welcome. I'm Dr. Shruti Arbati Pathe, and I will take you through the first aid and first line preparedness for heat emergencies. Is my presentation visible to everyone?
Yes.
Yeah. So I am an assistant professor in the emergency medicine department in MGM Medical College and Hospital, Kamuti. And I'm also a passionate teacher and trainer of trainers. And I believe in something called as a life-saving movement. And we've been working towards this for the last 10 years. As a doctor in the emergency field, the climate is not just a weather condition for us, but it's literally a medical emergency. For us, it's not a distant policy issue, but a severe patient, a severe medical patient coming with an emergency at our hospital gates every summer. From the trauma bay to the training hall, we see the cost that this invisible disaster is, costing us. Extreme heat, as we are all talking about right now, is the deadliest global event, and we can see the numbers, the documented deaths going up every year. Like Dr. Mazumdar just very beautifully explained how the heat trap works is, especially in high density populated areas in the cities, we see that the temperatures can go up as much as 6 degrees hotter in those densely populated areas compared to the other areas. And these temperatures do not go down even in the night time. What happens is, since we're talking about heat related changes, I think this quote here is just perfect, where we say that when we sweat in training, we do not bleed in the battle. And this is where we come from as emergency medicine doctors, where we have already we have established that we cannot stop this heat wave. The climate change is here and it's here to stay. But we can ensure that every citizen is a potential first responder. Where I'm coming from, what we are actually hoping to accomplish is to transform the community capacity to save lives in the first critical minutes. And why is that? Why am I talking about first responder care so much? Because the clinical mandate, if you look at all the guidelines, all the latest studies, and everything that we discussed related to heat emergencies, what we have established and we are talking about is delaying cooling in severe heat stroke can lead to mortality rates exceeding 50%. But when we have aggressive immediate cooling procedures in place, we can reduce mortality to near 0%. And therefore, cool first and transport second. So what happens is in the ER, we are the last responders on the scene. In the hospital, in the ER, we doctors are the last responder on the scene. And unfortunately, what happens is if the patients are not brought to us in a very salvageable condition, then there's not much we can do for them, unfortunately. We need our, drugs, we need our equipments to do our work, save lives inside the hospital in a critical care setup. But if there are very simple techniques related to cooling down a patient outside the hospital, immediate bystander care that can actually reduce mortality. What we'd like to, focus on is the differentiated triaging that can be taught to the bystander first responder. By differentiating the various levels and degrees of heat-related emergencies, we can actually take care of, a lot of morbidity and mortality related to heat emergencies. We start with simple rash and heat cramps, where it's very simple, immediate first responder actions like moving to a cooler place, having the person rest, give them water, and hydrate them. Like we have discussed, prevention is better than cure. There are no two ways about it. But it is extremely important to understand that once the emergency has set in, what first aid are we supposed to give and what are we to do to prevent, further complications? Because frontline personnel, whether they are outdoor workers or community volunteers, they must be trained to distinguish life-threatening hyperthermia from self-limiting heat stress. The distinction is critical because treatment protocols are strictly opposite. When we're talking about heat exhaustion, the protocols explicitly require oral rehydration to restore fluid and electrolyte balance. However, the standard of care when it comes to heat stroke, it demands that the moment a worker or a community member exhibits signs of confusion, slurred speech, or begins to faint or lose consciousness, the situation must be elevated to a heat stroke protocol where you cannot give anything by mouth. Immediate cooling and bringing down the body temperature becomes extremely important. The water, rest, and shade are something that really need to go out there, and we need the community prepared for these protocols. Cooling, cold water immersion techniques are known to actually improve the recovery and reduce mortality rates. This is something that we are really, we talk about training people in. Mass community trainings are a must, is something that we appreciate and we understand, especially in vernacular languages and local dialects. The attrition rate is extremely high. The attrition rates for all of these training programs, the life-saving techniques, and the theory part of it, the attrition rate is 90% at 9 months, which means that all the trainings that we provide going out there into the community, the people, 90% of the people who have attended this training will forget 90% of the information in 9 months. And sooner if they are, if they have not connected with the training program. So coming up with curriculum that connect with the common man, and using the vernacular medium languages, and creating trainers who can connect with the people out there is very, very important. Equipping these warriors with simple hypothermia kits, like, which contain oral rehydration salts, water bottles, and cooling is extremely important. So these are things that we find that are extremely helpful, very simple, yet in the long run, this is something that is going to change the landscape, because bystander help is going to improve the outcomes of patients when they are brought to us in the ER. Apart from that, of course, Sujata madam has already talked about the early warning systems, and it's really wonderful that we are discussing these things, because for us as doctors in the emergency rooms and in the casualties, we do not get enough time to prepare for the patient load that comes in. So if we have early warning systems, excuse me, is my presentation still visible to you?
Yes, but the slide is blank.
Just a second, sir. I think there is some, let me just,
Yeah, please take your time.
yeah, there's some technical error here, I think. Let me just share the slide again. Just a second. Is it visible now?
Yes.
Okay, thank you so much. So, what we are looking for is if we can have early early warning systems, not just in terms of the meteorological weather reports, but even where we doctors in the emergency room can be informed. So we are prepared for the patients coming into us and taking care of them, having ICUs and everything set up for that. Creating climate resilience hubs in schools, library, community centers are also something that we would look for, because going back to the roots is something that we are really, what we see during summers, in fact, early March, what we see is the students are coming in with heat exhaustion more and more. The latest systems where I love how Sujata madam and Dr. Muzumdar really included the olden day wisdom here, where the newer school systems where blazers are worn to school are something that is extremely critical, because we are a tropical climate, and blazers are worn in temperate region areas, and just in the name of trying to change the outfits that we're wearing is going to cause a lot of issues, is what we're seeing. Students come in with heat exhaustion because what happens is with the blazers, the AC is a requirement inside the schools and offices, and even with all the work systems. that is in fact increasing the atmospheric temperatures even more. Wearing, really soft linen or soft, cotton clothes is something that is important. So school children are what we see coming in with emergencies to the department, and dehydration is something that people do not understand. So providing these basic education tips and teaching even children about how to deal with heat emergencies, like when to drink water, having regular water breaks in schools. These are preventive measures that will go a long way, because what happens is when they come to the ER, we are left with only so many options to start treating them, and they're all invasive when it comes to treating an emergency that is already set in. So in these cases, prevention would be wonderful. Providing cooling welfare checks and resources as something that we would talk about more. Uh, so when we talk about what we are supposed to do is a two-pronged mission. Year-round training and standardization is something that we are already trying to accomplish with the work that we're doing in the life-saving movement. And the long term is, of course, championing structure, resilience, and infrastructure. The entire goal at the end of the day is to ensure no life is lost because there's no trained responder available during the first few minutes. And this is all about the golden period at the end of the day. Having a comprehensive community around us during the golden period in heat emergency is what I would really emphasize on. And thank you so much for having me, and welcome to the life saving movement. If there are any questions, I would like to take those. Thank you so much.
Thank you so much, Dr. Shriti. You framed extreme heat as a medical emergency and disaster, and many people in India still fail to recognize that heat
Yes.
could be, very dangerous in future. You also highlighted that frontline action and rapid response saves lives, and heat-related deaths are completely avoidable, and we need to work towards that. Your presentation also highlighted life-saving protocols like first aid, transport second, and also the differentiated triage for heat-related illnesses. And in the end, you recognize very important role of communities and training to win the battle against heat. So thank you so much for very informative presentation. We really
Thank you,
enjoyed
sir.
it.
Thank you, sir. Thank you
And
so much.
now, thank you. And now we would like to move to our Q&A section. In case if you have any questions, specific question to speakers, please feel free to put those questions in the chat box. Uh, I was reviewing the chat box, and there was some discussion about the governance and partnership part. And participants were discussing, who should be doing what is the role of CSR, what would be the role of NGOs, what should be the role of policymakers, how can they come together and do something for reducing heat related problems in communities. So, is there any experience that you'd like to share, any of the speakers, on successful partnership that has worked for all of us in any part of the India?
Yes, I can talk about one partnership. In fact, the one that I mentioned also in my presentation. First of all, let me thank all the co-panelists for excellent presentations. Something there to learn from. And I think this is very well done, like stitching together everyone's talks. Specifically on the question, so this layering of public health data with the climate data, which we did, this was a partnership that the Public Health Department at that time in 2015-16 did with UNICEF, with the National Institute of Virology, with the IMD, that's the Indian Meteorological Department, and also with the MRSAC, Maharashtra's Remote Sensing Center in Nagpur. So although all these organizations were all government, but this partnership was purely technical in nature, and these were across several verticals within the government, and the funding was provided by UNICEF, and this was a great learning experience for all of us. I was public health secretary at that time, and I was very keen to understand how do I deal with heat during the long season, and I mean long in the sense that Some parts of the state see a shorter season, but generally it's Vidarbha and Marathwada which see a longer season. And we are very much a state that is sometimes overwhelmed with the monsoon. So we are always focusing on the monsoon, and after the monsoon is over, we have heave a sigh of relief, and then we get back to business. And then, but very soon summer is upon us. We get a very short winter, as you know. So that was a very good partnership that helped us all, I feel. And these kind of partnerships must be worked towards for better learning and understanding of climate and what is happening around us.
Thank you so much, Sujata ji. I wonder if Mr. Anand has some experience to share around partnerships and also the role of children and youth in implementing nature-based solutions in Maharashtra and India in general. If you have reflection on that.
Yeah, thank you very much. In fact, I forgot to mention about the nature-based solution, because when we talk about this technology, I was actually speaking with one of the colleagues in health departments day before yesterday, ma'am, and then she said that, okay, what are the external factors that can add to cooling effect? So maybe, the tree plantation around the buildings could be one of the, nature-based solution that can happen. As far as I think children and the youths are concerned, yes, UNICEF in Maharashtra, we are very much working with youths. We have a platform called as MICA, Maharashtra Youth for Climate Action. That MICA.in, that's the website. And there are a lot of youths. We have tied up with the Higher and Technical Education Department, and I think close to 1,800 colleges across the universities. And they have been working around these 7 simple climate actions, right from stopping the leakage to using or stopping showers, which is debatable, but yes, we have been working, and the experiences are really really very good. Other than that, I think the life thing that was announced by the Prime Minister, I think this is something which we need to kind of propagate among the school students as well as the youths. I think that's the story, but it should the experiences always show that these stories end up in a period of 2 to 3 years. I think maybe the best part of that is that going into an action-based teaching as far as learning and studying in the schools. And I very much kind of was looking at the presentation by Dr. Shruti and Dr. Mazumdar also. I think these are some of the things that could be like, for example, exposure visit to IITM by the students, or how do you look at the emergency situation, at least the panic side when such kind of situations happens. Students or the youths are not there is not a fear amongst them, but they are able to kind of cope up. Okay, these kind of things or heat stroke can happen, or vice versa. That's one thing. Second thing, I think as far as the partnerships is concerned, I would say that the CSR which is there in India now is going to be threefold by 2035 as per the latest CSR report. I think there could be a initiative by the government or maybe by the partners within India, because I know that there are there are participants from other countries also, but the partnership with CSR could be explored. In fact, I was in touch with couple of CSR, but these kind of initiatives initially need a bit of financing. I'm sure the Global Climate Fund or green financing and then a lot of these green bonds and all those things are coming up. This is going to be a very interesting, situation in the coming era. But yes, there is a good scope for attracting the CSRs collectively as part of partnership with government. Some of the CSOs or the NGO partners do have a very good rapport with the CSR. I think if we have to work in the space of climate change, as I said, it's an opportunity. Probably some of us will have to kind of sacrifice the traditional approach of getting into, the various projects related to basic rights or health or education and all those things. There, the trend is already set. But for the climate change, yes, some of our partners needs to kind of, influence, rather I would say insist on taking up these kind of activity. But yeah, I think, and of course I must thank AIDMI for these kind of webinars. These are very visual webinars, and we have good speakers, of course, experienced speakers. These experiences and webinars are definitely helpful. And the beauty is that we have practitioners to policymakers to, various stakeholders being part of this. So
Thank you so
thank
much
you for
for
the
the
opportunity. Yeah.
Thank you so much for the response, Anandji. And I think we can take one more question, last question. And I think it is for the last panelist. And a participant is asking, how do you create community resilience hubs using decentralized networks?
Thank you so much for the question because this is what we're trying to do. Like even when we're talking about CPR and AEDs, what we say is we are a democracy. We don't always need the government to come in and give us a mandate about what you should or should not be doing. We are a democracy, and I think we are one of the most intelligent people in the country, considering the genetics and everything. We are really very resourceful. Jugaad is something that is in our blood. So I think we can have a lot of when like-minded people can come together and brainstorm, we can come up with many solutions. Like here itself in the webinar, we've heard about so many solutions, like translaminar. You don't have to have laminar flow, but just the cross ventilation. So if you look back, going back to our roots itself, the kind of clothing that we wore in India was very much related to the geography and the tropical nature of the climate that we lived in. We had loose clothing, thin, really something that absorbs heat, sweat, and can manage heat. We had housing, the architecture was in a way where there was cross ventilation. If we still go back to the olden architecture, we can see that that was mandatory. We would have trees around ourselves. So we can come up with these kind of solutions, and there are lots of, I think, younger generation, like we are just talking about the youth here. I think more and more younger generation architects are moving towards natural resourcing rather than cement structures, basically going back to the roots as we speak. And in fact, in my trainings that I we also have we are working with small CSR projects where we go to the schools and we teach people basic first aid. The toddler programs, we're teaching them how to put on a band-aid and stuff. What we realize is these children are the future citizens of the country. And what we see that these people go back home and they start questioning the adults. This should be done this way, this should be done that way. In fact, we have had many children come back to us and say that they have, in fact, when we talk about fire and others, they have literally changed where the cylinders in the home are kept. So they are, very, very much, key to changes being brought about in their domestic environment as well. So they can make this happen in the schools, colleges, and areas in the community where when there is a heat wave, we can have these hubs where if the emergency is so high, if it is an actual disaster that the local hospitals and the local fire stations cannot accommodate, we can have these kind of hubs where green revolution can be brought in. I see a surge in microforests also that are coming up. Rainwater harvesting is something that we are all talking about and getting implemented in many areas. So when I talk about climate resilience hubs, these are the ideas that can be implemented and something concrete can come out of this. So that is what I mean when I say decentralize the whole thing, because at the end of the day, it's a democracy. It's of the people, by the people. So the by the people needs to come out more and get implemented more. And because this is what we're trying to do. At the end of the day, there are only so many doctors who can help you inside the hospital. Outside the hospital, even we are first aiders. We are also going to be doing the exact same thing that every other common man is going to do. So if we can empower the lay person with all these, skills, you don't have to come to us. So our hospitals will have real emergencies and not heat related emergencies. And that's the kind of world we want.
Thank you so much, Dr. Shriti, for very specific response. And now I invite concluding insights from Mr. Mihirar Bhatt, founder of AIDMI, who has been working extensively at the intersection
Okay,
of
okay.
heat, nature,
Yeah, thank you,
and
thank you.
counter process.
Yeah. No, I mean, Mehul, this is very kind of you to do that. I'm so excited that we've been able to take a very specific state of India to show how extreme heat at national level in a very effective manner. Obviously, the state has learned from other states, but state also has the leadership to share what it has learned in 2025 with us. So, I'm fully aware that Chiranjeev is here. Michael, you are here. Our great supporter, Loy, our great supporter, you are here. Sabji, you You are here as well, so I'm very happy to see all of you here. And any ideas you have in taking any of these ideas further, do not hesitate to be in touch with us. AIDMI will be very happy to find ways of doing it or find somebody who can take that. Also, for any future work coming out of this, if you have ideas, any suggestions, do not hesitate to be in touch. And that's one of the most important things that this particular series that we are doing is achieving. I'd like to say Sarvana Namaskar, Hardik Shubhecha. Thank you for joining us for this important conversation on how Maharashtra is moving from long-term healing resilience. Extreme heat has become one of the most serious climate risks of our time. It affects public health, as we've seen, livelihoods, energy systems, education, and entire well-being of every citizen. There cannot be any other national issue as important as extreme heat. It slows down our march to what we call Viksit Bharat. It does slow down extreme heat impact that happens not only on people but on the economy as well. Maharashtra has recognized this early and has taken bold steps to lead India's energy transition. Today's roundtable has brought together government leaders, scientists, humanitarian actors, and community organizations who are shaping this journey. I want to thank our leader today, Dr. Sujata Swami. Thank you very much. And our panel members, Dr. Anand, Dr. Min Majumdar, Dr. Shruti Arabakti, for sharing their insights on governance, public health, climate science, and frontline preparedness, which is so important. Their work, as we have seen, reflects the integrated approach necessary for effective heat resilience on the ground. Also, states leadership. Those states have such integrated approach continue to lead, and those who are trying to, they want to integrate better. I also want to talk about the launch, the special issue of on Heatwaves to Clean Futures, Maharashtra's leadership in climate action in India. So it is about Maharashtra. This issue documents the state's innovations, cool roof, green corridors, heat action plans, worker safety guidelines, and community-led cooling practices. I would recommend the participants to look at it more carefully. It will be very useful to policymakers, project makers, those who evaluate performance, also for those who are academically interested. It celebrates Maharashtra's commitment to climate resilient development and is ready reference to corporate, government, and civil society organizations across India. As we look ahead, three priorities stand out, and I would like to conclude with these three priorities as a way ahead. First is cooling must be seen as a public good, as Maharashtra has seen. Sarvajanik Hitvata. We need cool roofs, green corridors, shaded public spaces, in climate-smart homes, in workplaces that protect the most vulnerable, workers, children, tribals, migrants, and informal settlements. And when these people are in focus, and these activities, is the public good is taken. The state leads and its citizens are well protected. Cooling is not a luxury. Maharashtra has shown us it is a public good. Maharashtra shows that when governance, science, and communities come together, cooling becomes a pathway to dignity, safety, and resilience. And similar activities can be followed up into 30 cities in next year or two to spread, deepening from subnational level to city level. Second, we must strengthen early warning and early cooling action. पूर्व सूचना आणि प्रारंभिक शीतलकृती. The upgraded State Emergency Operations Center is a strong foundation. And heat alerts must translate into local decisions, health advisories, and community actions across districts. Extreme heat is no longer a threat. It's a year-round humanitarian challenge. Maharashtra's leadership teaches us all in India, even beyond. Early warning must become early cooling action. And early action must cool every vulnerable citizen. At least in 30 districts by 2027, what has happened at the state level will be deepened in Maharashtra, at least, of course, in other states as well. Third, we must continue building what I call cooling justice. That is part of humanitarian justice by building community and institutional capacity. That is samuday and sansthatmak sthirta. Training volunteers, teachers, youth groups, and frontline workers is essential for reducing heat-related illness and saving all lives and incomes during emergencies. And at least these 10 sectors within the state can do that. That is building capacity and institutional capacity by 2027. To start within Maharashtra, but other states can learn and pick up from that. The future of cooling justice lies in partnership. When government, communities, and institutions work together, cooling becomes possible even in the hottest cities of India. Finally, partnership is our greatest strength. We've seen in this particular session, but also we've seen in Maharashtra, the reason it's leading is because of the partnerships. Cooling futures require collaboration across government, research institutions, private sector, civil society organizations, and communities, most importantly. Maharashtra offers a powerful example how this can be done with existing resources, plan, and people. This could be shared with at least 10 other states before the summer of 2026 comes upon us. It's not so difficult. We have the example. We have a package that this particular webinar has already created, and others should use it as best as they can to make sure that other states also benefit from it. Let us use today's dialogue to deepen this cooperation and commit this Sahakarya आणि वचनबद्धता, cooling justice, विकल्पा न्याय, that is inclusive, affordable, and nature aligned as it is in Maharashtra. That is samaveshak, pranane, and nisarga sangat. Together we can ensure that Maharashtra continues only in responding, seeking an extreme heat resilience for India. भारतातील सर्वसांशी उष्णरोधक भविष्य. Thank you. धन्यवाद. आम्ही अत्यंत आभारी आहोत.
Thank you so much. Thank you so much, Meherbhai. Thank you everyone for joining us today. We appreciate your presence and look forward to working together in days to come. Thank you so much. Bye-bye.
Thank you,
so
everyone.
much. Thank you so
Thank
much
you.
for having us. Thank
Thank you
you.
very much. Thank you.
Thank you so much, sir. Thank you so much.
Thank you, Sujata ji. Thank you, panel members. Thank you, all the participants.
Thank you so much.